Buenos días. Para mí es un placer presentar la sesión inaugural del Día Mundial del Pulmón Crítico en representación de la Sociedad de la Federación Panamericana de Medicina Intensiva.
An Iberian Federation of Critical Medicine, and as a president of the Intensive Care Societies, I would like to thank the organizing committee for the
a todas las sociedades científicas que han
and
apoyado
to all the
este evento,
scientific
así como la
societies that
industria,
have supported this event,
especialmente
as
a los
well as the
ponentes y a todas
industry,
aquellas
and the
personas que van a
speakers,
participar
and
durante
all the
todas
people that
las
are
horas
going
del
to
día
participate
en
today
esta jornada en la que se va a
in
hablar
today's
de
session.
todas aquellas patologías
We're
que
going
afectan
to
al
speak
paciente
about all
crítico,
pathologies
que
that
están relacionados
affect
con la
the
enfermedad
critical patient that are related to critical lung diseases. Since 1950s, with the poliomyelitis academy favored the treatment through mechanical ventilation, many things have changed. The reality is that not too many specialties have changed as intensive medicine, and these advances are in relation to technological advances, improvements of technological advancements, and improvements in the motorization of the different systems. This has led intensive medicine to have a important global load of diseases, and therefore the patients with ARDS present a very high mortality rate, even over cancer rate. And the resources of these critically ill patients is a bit increased because the economic impact in many countries by these patients is very high. The respiratory failure and COPD are the third cause for death in countries such as the United States. Despite these advances in intensive medicine, respiratory disease is still having a high prevalence and generating a high mortality and morbidity. And according to the series and the type of pathology, acute ARDS has a mortality between 40 and 65%, and this is especially high in some situations where respiratory failure is associated to pathologies such as sepsis. Mechanical ventilation was the main support for the patients with ARDS that come to the CIUs. The situation has changed lately. Some years ago, patients with mechanical ventilation were few, and now the improvement of this system and other systems has enabled intensive medicine to improve significantly. But we must not forget the safety of these systems and the risk that they can present, and therefore it is important that adverse events can be related to mechanical ventilation. And in the study published some years ago by the CIU, it was saying that a lot of other diseases were related to mechanical ventilation, and there are other publications where the epidemiology related to mechanical ventilation related diseases are studied, and therefore this is the reason for the study on the prevention of reintubation during mechanical ventilation, so that we have to ensure the highest possible quality of the process. And respiratory diseases are a very important load on a global level due to the incidence and the mortality of COPD, asthma, respiratory infections, tuberculosis, or lung cancer. Some are going to be dealt with in the next sessions, specifically the ARDS that somehow has high incidence. 10 to 86 cases per 100,000 inhabitants in countries such as Australia and the United States. And this is a pathology that is not always diagnosed in developing countries, but also in developed countries. ADRS is a major public health problem that incurs high health care costs and causes major mortality in the intensive care units, despite the improvements made in the latest years. And the recent changes in the new Berlin criteria and the new studies that have been implemented in this pathology probably will lead us to successful strategies in the following years. 10% of the patients that enter the intensive care units or that are admitted to the intensive care units, and 23% of mechanical ventilation patients had ARDS. And despite the improvements, the mortality of this pathology is extremely high. And this is why it is important to have guides or guidelines that establish the scientific evidence to fight against this pathology. Recently, the guides were mechanical ventilation is detailed, have been published. It is also important to speak about the consequences on the longer term for the prolonged mechanical ventilation patients, despite the fact that they survive to being discharged after their stay in the ICU. There are significant alterations on the longer term, both in the patients and the families of these patients. And therefore, many patients with distress syndrome or ARDS syndrome that have been discharged from their hospitals are presenting sequelae, long-term sequelae of critical illness, both physical morbidity and neurocognitive and psychiatric morbidity. And this has an impact on professionals and a significant impact on the patients and the caretakers or caregivers of these patients. Another disease that is going to be dealt with today is respiratory infection. We know that this is one of the most frequent diseases in our ICUs, and the lungs are the most frequent focus of infections in the patients admitted in the ICUs. The study has been repeated recently, and we will have results of this new EDIT 3 study, and we know that this happens in all continents. Another study that gives us information as for respiratory diseases is the IC Glossary study, published in 2016. It is a multi-center, multinational study that proved after 2 weeks that 12% of the patients that were admitted were having a very serious symptomatology. And we will also deal with the problems associated to mechanical ventilation and the programs that are in place to prevent this adverse event that has so much impact in the evolution and the mortality of our patients. Other pathologies we are going to deal with today is the COPD, a very frequent disease. Between 5 and 10% of the population are going to suffer from it. COPD is responsible for about 700,000 hospitalizations annually in the United States, where it has a significant cost per year, and is one of the diseases that are causing more mortality among the 6 diseases causing more mortality from the 80s onwards. Asthma is another disease that we are going to speak about. With increasing control of infectious respiratory disease, asthma is one of the most frequent diseases, causing 180,000 deaths worldwide each year, and it has an important impact on costs and we have to think that it can affect a very high percentage of a very young population. The disability adjusted life years of this disease is high, and as I said before, and it is represented in this graph, it's very especially young population that have a disability regarding years of life. Also, tuberculosis is going to be dealt with today. This is a frequent respiratory disease. In the year 2012, it was considered to have produced the death of 1.3 million people, primarily in where the HIV is very developed. In the WHO estimates that there is an economic loss of 8.7 million, an annual loss of 8.7 million years of life worldwide, and a third of the world's population can have a latent disease. The representation of the 9th cause for death in the world. I'm talking about tuberculosis all the time. And also another pathology that causes a very high impact of deaths is lung cancer. 1.5 million deaths annually, which accounts for over 15% of all cancer-related deaths. And in this case, lung cancer is highly preventable. Finally, there are more and more immunocompromised patients, and this increase is going to be held in the following years. And the ARDS is the main cause for admission of these patients in the ICUs. Mortality is really high, over 60%, and it is precisely the delay in admitting these patients or the delay in establishing of the non-invasive, the failure in the non-invasive therapy, or maybe an invasive fungal infection, or where the etiology of the disease remains undetermined. This is what leads this high mortality. In any case, we have to identify the cause for this respiratory failure. To conclude with, I want to say that the research in all this area, the critical respiratory disease, is going to lead to significant improvements in the prognosis of this pathology in the coming years. To finalize with, I would like to put the presentation, of Dr. Nestor Raimundi, who is the president of the Iberian Pan-American Federation of Critical Medicine and Intensive Care Societies. Thank you.
Dear friends, it is an honor for me as president of the Pan-American Association to be able to inaugurate today this session. This has been organized by a very proactive committee with people around the world. The idea was born a year ago, and my association supported it since the beginning because this is the only way all countries can work towards the use of the technology. This committee, Dr. Cardinal and Blanche, and all the doctors from Colombia. The Iberian and Pan-American Association thinks that this type of activities supported by technology are the way we can all unite, all of us who work in the intensive care units. I also want to thank the industry for supporting this activity today. Thank you for your presence. And I have to say that it's over 3,000 people are listening to us today throughout the world. Thank you.